this side, and like I said, you can cross the patient's arms in this fashion. And normally, I think he's got it open in the back, okay. If I say you'd be skin on skin. Just bring the legs a little closer together. So now, if I was going to correct for flexion, I'm going to flex his neck down, and I'm going to roll the patient into this position. I want to keep them in that position. So I would tell the patient, I need you to keep your head tucked down and keep yourself rolled in that position. I'm going to bring you down and apply a little bit of pressure in front of you with my hand behind your back. Okay? Is that okay? He says yes. Go ahead. So again, I can take my arm, I can use my whole form on his form, and I can put my hand here, so I can now, when I come down, I can control his head. I can do it this way. So if I come down, I want to keep him flexed, I keep him up this way. So that controls his head. If I wanted to bring him into extension, I would tell him, let your head go back, and then I can control his head. So that is one way you can do it. If you feel you can't do that, then again, I can just grab here. He would have to stay tucked, and I can do it in this fashion, here. Or maybe this is better. This is something that you got to decide once you start doing it, which one works best for you. It's not a right or a wrong way. You kind of develop, there's a multitude of ways of doing this front hand contact. But again, the big thing is when you come down in this position here, you make your contact, and you come down here. Once my hand hits, I kind of raise myself up over the patient, and then I can drop down this way. I'm kind of using my body and my arm. Let me come back up. I'm using my body and my arm, so I'm coming down, in this fashion. It's not that I'm just coming down and pushing with my arm. This becomes like one unit, and I just use my body and the momentum of the patient going down. So you got the momentum of the patient, you got your momentum, but you got to be controlled. And again, your leg is against you, which stabilizes you, so you can use this table to your advantage. So the big thing with this one is because it's same side, we're coming around, we're in the middle, but we're coming around from the same side we're standing. But the other one, when you just lie straight on your back, squeeze up, a little bit higher up. Remember this one we called an opposite side contact because we would get to the center of the body, but we would just come around from the opposite side we're standing. And then we raise the patient and come down and do our thrusting. So that was, some people like the same side, they feel